Okay, anyone who's a parent or has just spent time scrutinizing a newborn's skin knows what I'm talking about. Baby skin can feel like, well, a minefield. Bumps, rashes, spots. They just pop up and vanish sometimes, and it can feel really overwhelming, right? Trying to figure out, is this redness serious? Is it an infection? Or maybe just the laundry soap? Or is it, just some weird temporary thing that'll be gone tomorrow? You, our listener, you're looking for some clarity here, a kind of simple guide.
And that's exactly what we're aiming for today. We're doing a deep dive into the sources you sent, looking at the 10 most common skin issues in babies.
Mm.
We want to give you the context, what they look like, and, really importantly, those rules of thumb. When can you just handle it at home, and when does it really need a doctor's visit?
Yeah, it's a vital conversation because honestly, these things are incredibly common. Baby skin is just, it's immature, it's super sensitive. And just to give some numbers here from the material, diaper rash hits about 35% of babies. And milia, those tiny white bumps, you see that in up to 40% of newborns. So if you're seeing stuff, you are definitely not alone. Okay, let's unpack this. Before we even get into identifying specific spots, we need to understand the basics. Why is newborn skin so reactive compared to ours? What's the core vulnerability here?
It really boils down to the structure.
Mm.
Think of adult skin like a solid brick wall, right? Fully built, baby skin,
Yeah.
still under construction. The sources really emphasize this point. Baby skin is roughly 30% thinner than adult skin.
Mm-hmm.
And that thinness, it changes everything.
30%. Wow, that sounds like a pretty significant difference.
Oh, it is. And think about what that thinness means. The skin is way more porous. It's like, well, imagine an unsealed paper bag versus a Ziploc. So two big problems arise from that. First, moisture just escapes really quickly. They get dry, chapped, irritated much faster than we do.
Yep.
Second, because it's so porous, things from the outside, allergens, irritants from soaps or clothes, even minor toxins, they can get through that skin barrier much, much faster.
So basically, anything touching the skin has an easier time getting in.
Precisely. And then you add to that the baby's natural protective layer. Those lipids that lock moisture in and keep irritants out, it's just not fully developed at birth. Plus, their immune system right there in the skin is still learning, so it's not great at fighting off bacteria or viruses that might slip through that weaker barrier.
That makes so much sense then. It explains why everyday stuff, maybe a certain soap or detergent, even just changes in temperature can cause such big reactions. Their system is already kind of compromised. So dryness, which they're prone to anyway, can easily snowball into bigger issues like eczema.
Right, so let's start with maybe the easier group, what you call the benign bunch. I like that.
Yeah.
This category should bring some instant relief because these conditions are mostly hormonal blips or trapped cells, and the key is they usually clear up all on their own.
Exactly. And this is so important because these are often the spots that cause the most worry but need the least actual doing. First on the list, baby acne, or neonatal acne, affects about 1 in 5 infants. And the cause is fascinating, isn't it? It's not their hormones, it's leftover maternal hormones still floating around stimulating the baby's oil glands. I remember seeing that with my first and immediately thinking, oh no, what am I doing wrong? Is it my diet? The formula?
That's such a common thought. But no, it's got nothing to do with milk or what mom ate. You'll usually see small red or maybe white pimples, often on the cheeks, forehead, chin area. It tends to show up around 2 to 4 weeks old, and yeah, while it might stick around for up to 6 months in some cases, it nearly always just fades away completely by itself.
Okay, but how do we tell that apart from milia? Because those are also super common little bumps, right?
Great question, because they can look similar but are totally different things. Melia, and this affects up to 40% of newborns, so even more common, isn't hormonal. It's not about oil glands. Melia is simply trapped keratin.
Keratin. So, like dead skin cells.
Exactly. Just dead skin cells that got stuck in tiny pockets right under the skin surface. The sources call them epithelial cysts. They look like tiny, painless, white or yellowish pearly bumps. They aren't inflamed like acne often is. And they usually appear right at birth or within the first few weeks. Purely cosmetic, zero treatment needed. They just go away on their own in weeks or months as the skin matures.
That distinction is key. Hormonal oil versus trapped skin cells. Got it. Okay, moving on to some that sound, well, frankly, terrifying. Like erythema toxicum neonatorum. That name alone would send any new parent into a panic spiral.
Absolutely. The name is awful. But the condition itself is completely harmless. It affects maybe up to half of all full-term babies, usually showing up in the first few days after birth. You see these red, kind of blotchy spots, sometimes with a little yellow or white pustule right in the middle. A really key identifier, though, it almost always spares the palms and soles. Doesn't show up there.
Ah, okay. That's a good visual clue. If the hands and feet are clear, maybe lean towards this benign thing.
Right. And it's not contagious, just resolves on its own within a week or two, typically.
Yeah.
Then finally, in this benign group, there's transient neonatal pustular melanosis, or TNPM, much less common, maybe 1 to 5% of newborns, and statistically seen more often in African-American infants. What's interesting here is how it changes over time.
Okay.
It goes through 3 stages. First, you see small pustules, but they break open really quickly. Then they leave behind these little scaly, sort of ring-like areas. And finally, those evolve into flat, darker spots, hyperpigmented macules that can take several weeks or even months to fade completely.
So a whole progression.
Yes. But the big takeaway for all of these, baby acne, miliaut, erythema toxicum, TNPM, is simple. Hands off. Don't squeeze, don't scrub, don't use harsh soaps. They aren't infections. They're just part of the ride for many newborns, and gentle patient care is all that's needed.
Okay, this is where, as you said, it gets really interesting. We're moving from those internal self-clearing issues to the ones that are still non-infectious, but they need active management because they're triggered by the baby's environment. Let's kick off with the undisputed champion of management issues, diaper rash. You said 35% of babies get this, peaking around 9 to 12 months. This is clearly about what's happening to the skin.
Absolutely. It's basically skin damage caused by a combination of things. Being wet for too long, the friction from the diaper itself rubbing, and then the chemical irritation from enzymes in urine and stool. It's like a constant low-level attack on that already thin, vulnerable skin barrier.
So treatment isn't about curing it, it's about defending against those attackers.
Exactly. It's all about controlling the environment down there. That means changing diapers very frequently, letting the skin air out whenever possible, just a nappy-free time on a towel. And critically, using a good barrier cream, usually one with zinc oxide, to create a physical shield between the skin and the wetness and irritants.
Makes sense. Okay, next up. Baby eczema, or atopic dermatitis. This one feels more chronic, affects 10–20% of babies, usually popping up between 2 and 6 months. We know genetics play a role, but what sets off the actual flare-ups?
Right. The flares are where the environment really matters. Since we know that skin barrier is weak, it's super susceptible to triggers. Things like allergens, dust mites, pet dander, maybe even certain foods. Irritants like harsh soaps, fragrances and lotions or detergents. Even changes in temperature, like getting hot and sweaty, can make it worse. And crucially, dry skin itself is a major trigger. It's a vicious cycle. Dry skin weakens the barrier, which leads to inflammation, which makes the skin even drier and itchier.
So the management strategy here has to be relentless barrier support, not just treating the red patches when they appear.
That's absolutely right. The cornerstone is consistent, intense moisturizing. We're talking thick, fragrance-free, hypoallergenic creams or ointments applied multiple times a day, especially right after bathing. Then there's gentle bathing short, lukewarm baths, minimal soap, and sticking to soft, breathable fabrics like cotton helps reduce irritation too.
Got it. Now, a very specific location issue. Cradle cap, infantile, seborrheic dermatitis. I always assumed this was dry skin on the scalp, but the source material points back to hormones again.
Yeah, it's sort of a delayed hormonal effect, likely from those maternal hormones, again, making the baby's sebaceous glands, the oil glands, a bit overactive on the scalp. It looks like yellowish, kind of greasy, scaly patches. It's harmless, doesn't usually bother the baby, and typically clears up within the first year.
So how do you safely tackle those scales if they look kind of thick and crusty?
You manage it gently, mechanically. Before you shampoo, you can put a little baby-safe oil. Mineral oil works well on the scalp. Let it sit for a few minutes to soften things up. Then use a very soft brush, like a baby brush or even a soft toothbrush, to gently massage and lift the scales. Then wash with a mild baby shampoo. No harsh scrubbing.
Okay. Then there's heat rash, or prickly heat, miliaria. This sounds less like an oil issue and more like plumbing.
Exactly. It's a blockage problem. It happens because the baby's sweat ducts are still developing and can get blocked easily, trapping sweat under the skin. The source mentions different types. The mildest is miliaria crystallina, tiny clear little bumps. The one we usually think of, the red, itchy, prickly rash from being too hot. That's miliaria rubra.
And the advice for heat rash seems almost counterintuitive because the instinct is often to slather cream on anything red.
You nailed the most crucial point. Home treatment is purely about environment. Keep the baby cool and dry. Loose cotton clothing. Avoid overheating. And importantly, do not apply creams or lotions, and especially not powders. Thick creams and powders can actually clog the pores more, which caused the problem in the first place. It just makes it worse.
Good to know. Avoid the creams for that one. Lastly, in this category, one tied directly to a developmental stage. Teething rash, the drool rash.
Yeah, this is basically a form of contact dermatitis. All that extra saliva when teething just sits on the skin, acting as a constant irritant. It breaks down the skin barrier around the mouth, chin, neck area, gets red, maybe a little chapped or bumpy. The fix is just constant gentle vigilance. Wipe away the drool frequently, keep the skin as dry as you can, and then apply a simple barrier like petroleum jelly or a mild moisturizer to protect the skin from the ongoing wetness. Okay, now we need to pivot. This is maybe the most critical part of our deep dive. We've talked about the benign stuff that goes away, acne, milia, and the things you manage environmentally, eczema, diaper rash. Now we have to clearly draw the line between those everyday irritations and actual infectious diseases, things like bacterial impetigo or fungal ringworm. These need medical treatment.
Right, because for a parent, any spot can feel like an emergency. Let's really nail down the difference. When does a rash cross the line from, let's watch this, to, okay, time to call the doctor? What are the definitive red flags?
We need to look for specific, severe signs. Let's call them medical red flags. First and foremost, clear signs of infection. Are you seeing oozing, crusting, especially that characteristic yellow or honey-colored crust, often around the mounds or nose? That's a big signpost for impetigo, which is bacterial and definitely needs antibiotics.
Okay, honey-colored crusting is a big one. What about changes to the skin right around the rash?
Yeah, look for pus, actual pus formation. Significant swelling in the area. Is the skin around the rash unusually warm to the touch? Or do you see red streaks starting to track away from the rash? All of those suggest a more serious, localized infection that the body is fighting hard against.
And we also have to think beyond just the skin, right? What if the baby seems generally unwell?
Absolutely. Systemic symptoms are key. If the rash comes along with a fever, that's a major sign. It could point towards a viral illness like roseola, maybe chickenpox, even measles. All of those need a proper medical diagnosis and specific management, regardless of what the rash itself looks like.
And then there are just the general rules about severity and duration, I suppose.
Of course, common sense applies too. If any rash just keeps getting worse instead of better over, say, more than a few days despite home care, or if the baby is clearly miserable, really fretful, scratching constantly, not sleeping well, it's always wise to get it checked out professionally. Don't wait too long if things seem severe or aren't improving.
And one more really critical one, the allergy warning.
Yes, the allergy red flag.
Yeah.
If you see hives, those itchy welts, and they appear alongside swelling, particularly of the eyes, lips, or throat, it's called angioedema. It signals a potentially severe allergic reaction and needs immediate emergency medical attention because it can compromise breathing. Don't hesitate on that one.
That's crucial. Eyes, lips, throat swelling with hives means call 911 or head to the ER right away.
Exactly. And while most of these baby skin things are temporary, the sources do mention a long-term risk we should acknowledge. If you have an untreated bacterial infection like impetigo or really severe chronic scratching from eczema that isn't controlled, it can potentially lead to permanent changes like scarring or thickened skin. So getting proper treatment promptly is important for avoiding those rarer outcomes.
Okay, so to wrap this all up and bring it home for listeners, let's summarize those concrete, actionable steps. The things you can do every day for prevention and basic skincare, reinforcing that fragile barrier we started with.
The daily routine is truly foundational. Let's start with bathing. Keep baths short, 5 to 10 minutes max. Use lukewarm water, not hot, and be really stingy with soap. Use only gentle, hypoallergenic, fragrance-free cleansers and only where needed. Lukewarm water and short baths help keep the skin's natural oils intact. And maybe the most overlooked part, gently pat the baby dry. Don't rub. Friction is the enemy of that delicate skin.
And then the step that comes immediately after patting dry.
Moisturizing. This isn't optional. It should be done daily and critically, immediately after the bath while the skin is still slightly damp. Applying moisturizer then is like locking the door while the moisture is still inside. It seals it in. This is probably the single most effective thing you can do to strengthen the barrier and prevent dryness, which, as we've seen, makes almost every common rash worse. Use a good, fragrance-free emollient.
Okay, immediate moisturizing after the bath. Got it. And for that most common localized problem area, what about hygiene and diaper care?
Meticulous is the word. Change diapers very frequently. Don't let the baby sit in wetness. And use that zinc oxide barrier cream liberally and consistently, even preventatively. Think of like putting wax on a car. You're protecting the surface before the damage happens from wetness and friction.
Makes sense. And finally, clothing and the environment around the baby.
Comfort is key. Dress the baby in soft, loose-fitting clothes made of breathable cotton. This reduces friction and helps prevent overheating, which we know causes heat rash. And if you live somewhere dry, especially in winter when the heating is on, consider using a cool mist humidifier in the baby's room to help keep moisture in the air, and thus in their skin.
That really brings us full circle, doesn't it? The main takeaway seems to be baby skin issues can look confusing, but most fall into predictable buckets. You've got the temporary cosmetic stuff, the environmentally managed issues like rashes and eczema, and then the infectious red flags. Knowing how to sort them is really the key piece of knowledge for parents.
It really is. And if we zoom out for a final thought, given that dry skin seems to be the common enemy here, making almost everything worse, eczema, diaper rash, even cradle cap seems worse when skin is dry, and knowing that baby skin actually heals incredibly fast when it's healthy, what's the one single habit parents should prioritize above all else to keep that delicate barrier supported day in, day out?
I think I know where you're going with this.
It has to be that consistent, immediate, generous application of a good, fragrance-free moisturizer, especially after bathing, but even throughout the day if needed. That's the number one defense. Build that barrier.
Excellent point to end on. Build the barrier. That's the core action item. Well, thank you so much for breaking all that down. And thanks to you, our listener, for joining us on this deep dive into baby skin. We'll catch you on the next one.